And Jerry joins us this morning from Marble City Pharmacy. And do you have your glasses yet for the
I'm not ready.
eclipse?
I'm not ready.
You got 6 hours or so.
I mean, I'll probably be at work. I'll be inside. Aren't I safe?
No, nothing is safe.
It's doomsday.
You didn't know that?
It's doomsday, I guess so.
I mean, don't you know people are flying to Little Rock and stuff to...
It's a big day.
It is, for sure. It's a big day for us here. What are we talking about this morning?
Osteoporosis. I'll start with just a definition. First of all, let me back up just a second. There's osteopenia and there's osteoporosis. You may have heard both of those terms. Osteopenia just simply means a weakening of the bone tissue, all right? Osteoporosis is really just a step further. It's a weakening of the bone tissue to where it gets so brittle that your bones can be broken by something very simple, sometimes even as simple as bending over or coughing. So it's a weakness in the bones. You guys may not know this, but your bones are living tissue. You're constantly losing bone and you're constantly making more bone. And when you're young, you make more bone than you lose. So osteoporosis doesn't really happen in young people. But as you get older, specifically starting after age 30, you begin to lose more bone than you make. And so there's a good fact for you today. Your bones are constantly being remade and you're constantly losing. And as you get older, the cycle gets reversed and you're just not making enough.
Is this particular to men, women, black, white, age groups, or what?
Yeah, it is. First of all, I guess some things that you can't change, all right? You're not in charge of your sex. Well, some people tell you are, but you're not. Females, it happens to females at a much higher rate. It happens in white women and Asian women at a much higher rate. Obviously, you can't change your race either. You can't change your family history. If you've had osteoporosis in your family, you're much more likely to get it yourself. And then there's very little you can do about the size of your body frame. When you talk about the stereotypical osteoporosis patient, it is an older woman who's smaller, who's skinny, and has very small bone structure. Mm-hmm. And so those are some things that you can't change. There are some things that you can maybe manipulate, such as your hormone levels. A woman who's past menopause has a much greater risk to having weak bones and osteoporosis because she no longer has estrogen. Estrogen is one of the things that helps you build bone. A man who has very low testosterone is much more susceptible to osteoporosis. Testosterone is one of the things that helps you build bone. And so there are some other factors we'll get to in just a minute, but those would be the main ones.
Wow. What age group is this now?
Older. Now we're talking about, especially when we talk about women over 50 or whatever age they begin to get past menopause. So over 50, men really probably over 70 is more of an age for men.
Are there symptoms, or how can we know that we're dealing with this?
Well, first of all, most people don't know that they have it until they have maybe fallen and broken a bone or some other way that they've broken a bone. There is a way to diagnose it. There's something called a bone density test. It's harmless. It's not invasive, but it's basically a scan of your bones to see what kind of thickness there is inside the bone. There are some ways to kind of know and kind of see. First of all, if you have bones that break too easily, if you've had one of these falls that's not really a big deal and yet you have one or more broken bones, that might be an indicator. You might have an indicator if you begin to stoop over. You know, you see older people sometimes their posture becomes to where they're kind of hunched over. When you see somebody who's losing height over time, sometimes that's an indication that they have osteoporosis in their spine.
Losing height.
You ever seen people who are shorter, or who say, maybe, or somebody will say to you, "I'm 1 inch shorter than I used to be," or "I went to the doctor, I'm 2 inches shorter than I used to be." So there are people who lose height over time, and a lot of times that's due to osteoporosis in the spine, right? I should have said this earlier, but the most common places for osteoporosis and fractures are in the spine and the hip. The wrist would also be a place, you know, sometimes if you fall, you try to catch yourself on the wrist. A lot of times you see those small bones in the wrist kind of snap. And then the last thing would be an indicator maybe. Sometimes people have back pain and they don't know it, but the vertebrae in their spine have become so weak that one of them's basically collapsed. So you got a bone density test that'll tell you for sure, but you do have some indicators sometimes.
Well, you're talking about the spine or the hip. that can become very serious.
Those are big time things. I mean, I've had back surgery myself. A lot of you guys that are watching today have had back trouble, but you begin to realize once you have trouble in your lower back that your lower back's literally connected to your entire body. And so when you begin having trouble in your vertebrae or your neck, you know, if you have trouble in your neck, you maybe have trouble turning like this, you got pain like that, you realize what a big deal that is, right? Hip fractures are another animal altogether, and hip fractures are a really big deal. And you guys know this because you probably had friends or family members in this area. But as you get older, if you fracture your hip, a lot of people simply don't come back from that.
You're right.
The rehab is very difficult. You have a much greater risk of blood clots and infection. Even my grandmom had a hip fracture she didn't come back from just this past year. And so this is, it is very serious. And so the things we're going to talk about in just a minute, things you can do to hopefully help prevent this are a major thing.
So how can it be prevented, or can it be prevented?
Well, as much as in our power to do so, we can prevent it. And honestly, these things need to start when you're young. So if there are younger people out there, I hope that you're listening. Let's talk about, first of all, maybe some dietary things. In your diet, you can increase the amount of calcium that you take in. So this is something that we can deal with very easily with numbers. If you are a woman less than 50 or a man less than 70, you need 1,000 milligrams a day. You need 500 in the morning and 500 at night because your body can't handle more than 500 at one time. So if you take 1,000 in the morning, you're just going to urinate the excess out. If you get to be over age 50, if you're a woman, over age 70, if you're a man, you need 1,200. So 600 twice a day. So somewhere between 1,000 and 1,200 of calcium every day. The second thing in dietary ways of prevention would be vitamin D. Your body can't use your calcium correctly unless you also take vitamin D. We talked about vitamin D a ton on this show. It's connected to a lot of things, but probably the primary thing is helping you to absorb calcium. And so if you're getting 800 to 1,000 units of vitamin D a day, you're probably in the right place. So those are your dietary things. And I should have said this a minute ago. Let me say this about your diet. If you are somebody who has decided, it's a popular thing now to be super skinny. If you're a person who's decided that you just got to be super skinny, I want you to understand you're at an increased risk of osteoporosis. I'm not saying everybody should try to be fat so their bones will be strong, right? But we do have to have a happy medium here. And so we do have patients who, I don't want to say have starved themselves to death, but barely eat anything ever. It's not healthy for your bones, all right? Now, moving on. Exercise is a major, if not the number one way to prevent osteoporosis. And to make your bones strong, you need exercises that are weight bearing, you know. And I'm not saying you females who are older need to go out and, you know, pump iron and become Arnold Schwarzenegger, but any kind of resistance with small weights or even kind of resistance bands or even just picking up a book or something along those lines, those things are good for you. When you get out and walk, that's weight-bearing exercise for your hips, right? And your lower body. So those kind of things are fantastic. Any kind of strength training, walking, running, jumping that you can do, it makes your bones stronger, right? And hopefully can prevent these kind of things. So, and then make sure that you don't have a sedentary lifestyle. If a person's going to sit on their couch all day, you're just going to be much more likely to develop osteoporosis.
Very quickly before we go, what about treatments? We've got about 60 seconds to go.
60 seconds. Okay, treatment. No need to spend too much time on this anyway. Your doctor's going to be in control of this. A lot of you are on these kind of medicines. There are medicines that help you build bone density. There are weekly and monthly treatments. You probably heard of Fosamax. You probably heard of Actonel. There are some injections. There's a once every 6 month injection. There's a once every day injection. There are hormones. Women can take estrogen after they get past menopause, but you got some risk with that, blood clots, maybe breast cancer. So you gotta talk with your doctor about hormones. So yeah, there are plenty of things out there, and we can help you with that.
And of course, you're always at the office, let them come by and ask you questions.
Absolutely.
All right, Jerry Johnson from Marble City Pharmacy. Help Monday every month here on Daybreak.